Hey guys, welcome back to the Texas THC Doctor YouTube channel. I'm here with Dr. Shah today.
Good morning, guys. How's everybody doing?
Good. So today we're going to be talking about dementia and how medical cannabis actually helps it. So I'm first going to be asking Dr. Shah a couple questions about it. We're just going to go over a few and just mainly focus on dementia today. So what is dementia, first of all?
Dementia is a disorder that affects the elderly, mostly the elderly, and there's different types of dementia. You know, we hear about Alzheimer's dementia. That's the most common type that we hear about. There's also vascular dementia. Now the difference between the two, one is affected more, as the word says, vascular dementia, affects people that have had like histories of strokes. You know how there's atherosclerosis or clotting of arteries that we talk about with heart disease? Well, the same thing can happen in the brain. And when that happens, it destroys that part of the brain, you know, lack of blood supply to that part of the brain. And that leads to cognitive issues like memory issues that we relate towards dementia. Now, Alzheimer's dementia is another type that, you know, we think is related more genetically. Also, we think that it can affect people regardless of their vascular issues. They can be healthy adults for most of their lives and then unfortunately start having issues with their memory. And that it gets worse as time goes on. They have issues you know, balancing their books, balancing their checkbooks, balancing activities of daily life, and then it gets even worse to the point where they have difficulty learning how to, you know, do things that they've done their whole life. You know, where they live, how to cook, and then it gets even worse where they forget to eat and they don't have a desire to eat. It's a really sad disease, especially, you know, seeing your parents or loved ones go through those stages where they were so, you know, well-to-do and able to take care of themselves to a point where you're taking care of them almost like children. And so, you know, that brings us to how does THC and CBD help, right?
Yeah, so I did actually do some research over how it helps and different studies that were done for that. Here, I'm just gonna look over it. I don't know if you want to look over it.
No, sure. You're allowed. You didn't go to med school, so you're allowed to look at that. So basically, you know, what we were asking was, you know, how does it help? Now, there's not a lot of research, as we know, on medical THC, right? But what the studies they have done, and now there's actually new pilot studies being done as well, in trying to figure out how it can help. The studies that have been done show that it can help with behavioral issues. I kind of went on that a little bit, but I didn't really go into detail. When people have dementia, you'll notice that there's periods where they get confused easily, and if someone is confused easily, sometimes they can get agitated and aggressive also. To the point where family members can't take care of them because they can be a harm to themselves or to their family. So this will actually help in calming their mood, giving them a more euphoric feeling, less agitated, less aggressive, and just in a better mood overall, which anyone's better to deal with at that point, right?
It's actually really common to see those symptoms in people with dementia as well. I personally had a member of my family pass away because they had dementia, but we didn't, it was before I was born, so not really anything I know too much of, but I know a lot of stories about it. But no one knew she had dementia until later on, but she was like the sweetest lady ever for her whole life. And then at the very end, she started getting really mean and aggressive.
Yes, and that's a common thing we hear. They get more, you know, just that confusion of not being in control of your life. It's really scary. Imagine for the patient that, you know, was living and totally competent and able to deal with stuff, and then suddenly they're not able to anymore. You know, that leads them to be aggressive towards people that question them, aggressive towards people that try to take certain rights away from them, like driving. And you have to, in certain cases, for not only their own protection, but protection of people around them. Leaving the stove on and then walking away, you know, Those kind of things are the warning factors. Now, that's why it's important to go to your primary care doctor as well as a neurologist. Sometimes you can go to a neurologist or specialist if the primary care doctor doesn't feel comfortable in doing sort of.
Yeah, and dementia is actually very common. About 1/3 of people over 85 do have signs and symptoms of it. It's not a normal thing for like the aging process, but it definitely is more common than you would think.
Yep. And you went on a good point there when you're saying that it's something that happens with age. A lot of people, as we get older, we call it senility, where we have issues with our memory. I know even people in their 40s, like myself, you feel like you're not as sharp as you were when you were younger. And again, those are other issues. That's not dementia. But when we get older, I think the elderly population of the 80s and 90s that end up with dementia, although it's not a normal process of aging, it is something that can happen from vascular issues. We all know that our veins, our blood vessels, our arteries, they get worse as we get older, and that can affect our brain blood supply, and that's what ends up happening with vascular dementia. Well, I think the only other thing that we would try to mention on this is, how do I get my family signed up for this? Is my mom or dad or my grandparents a candidate for this? The answer is yes. Just go to the website. If the loved ones have a diagnosis of dementia, just let us know. Fill out the forms. You can help them fill it out. If you want to call us, we can guide you through the process as well. And then we can get them on a plan that hopefully can improve their quality of life. And one of the other things is, if anybody has family members out there that have dementia, they usually put them on a lot of other medications. Some of them are to improve their memory, which is great. You want to continue those, right? The other one is usually for the behavioral issues that we'll get with dementia. One could be that they're agitated at nighttime or they're agitated during the daytime. There's something called sundowners, where they feel worse at the end of the nighttime and early in the morning as well. They get really confused. Well, with all those medications they start, they don't have much choices on what to start. So we start them on antipsychotics. We start them on benzodiazepines. This stuff makes them usually more groggier, less willing to interact with people. It also affects their mentation or their thinking in other ways, which doesn't really improve quality of life. And the family members and the patient themselves don't like being on those medications. And that's not saying for everybody. Some of those are lifesavers for people and allow them to take care of their family members without sending them over to a nursing home per se. Let's say if they do want to keep them in their own home and take care of them. The THC will provide an alternative. It'll allow to help with their behavioral issues, so they can hopefully get off of those kind of medications that can affect their brain in a way that's not beneficial.
Yeah, so actually in some of the studies that I researched, it was definitely a big sign that it was helping a lot, because these patients were choosing to get off certain medications because the THC was helping them so much more than those medications. It made them feel better, happier, a little euphoric for some of them as well. So THC is definitely something to give a shot if you or a family member has dementia.
Exactly. And it gives you an alternative where if you have using traditional medications and you're not finding any relief, like we said, medical THC is very, very safe. Especially if you're getting it through a doctor, it's very safe and it's very beneficial. It's impossible to overdose on it. I know a lot of people are afraid, putting someone elderly on medications like THC, because it's a medication. You're afraid, are they going to overdose? No, you cannot overdose on it. All right, and if you're prescribed by a doctor that actually knows what they're doing, you're going to start really low and then work our way to a dose that's beneficial for them. All right. Well, that was the thing we wanted to talk about dementia. We have quite a bit of patients with dementia, and I only get positive feedback from my patients and their families. People that weren't eating are now eating, and that's another problem that happens with the elderly. So, give it a chance. Go to our website, fill out a form. If you have questions, just call us. Remember, text us THC Doctor, and then our phone number, 830-549-5500. If you have a question or concern on what we can do for your loved one or yourself, just give us a call.
Yeah, thank you so much for watching, guys. If you have any questions or comments, leave them in the comment section below. Go ahead and follow our Instagram. It's at TexasTHCDoctor, and so is our Facebook.
All right, guys. Take care.